Hey, gardeners. It's Cubicle Events with Eve's Garden Podcast.
And Sistah Shay.
Lady D.
And Janique.
And today, this is a really topic, me and Lady D topic. We're going to discuss sickle cell and sickle thalassemia. So, you guys have questions? I know you do.
Yes,
Shay.
I do. I have a book.
Yeah, she got a book.
I wrote a book. And I've always wanted to know. And I tell you, it's amazing how God will put people in your life to answer your questions. So my first question, explain to me where sickle cell comes from, because I thought it was a black disease only.
I did too. Only until about 2 years ago, I did research, and it comes from Indonesia. It comes from Indonesia. It's Asian.
Wow.
Right. And a lot of people get it confused thinking that is a African disease or comes from Africa. But I've met plenty of Africans, whether it's getting my hair done or doing an event for them or whatever. And they be like, what is sickle cell? They really don't know much about it. But I think what happened was when with the malaria saying, we can't catch malaria. So basically, sickle cell came from your body fighting off that illness, the malaria illness. So because malaria was so prevalent in Africa, people just ran with that. That is an African disease, or, and it's really not. It really comes from Indonesia. But, a lot of Africans are mixed up with a lot of Asian, and I definitely know that it's come from Indonesia because I have a lot of that in my blood. And I also had got something else that was curable called echinacea, and that's another Indonesia disease. So I got 2 out of 2. So it's definitely from Indonesia. What's the next question?
Well, my next question is name the different types of sickle cell.
Okay.
Because you two have different, or is it the same?
Different.
Okay.
It's different. So sickle cell is a trait, which means you're just a carrier of the disease, which means you don't have any symptoms. Well, they say you don't have any symptoms, but I've met a couple sickle cell people that have the trait and that will have a crisis. It may not be as, severe as what I would go through or she would go through, but they have one. So anyway, that's the trait where you're just a carrier. So if you were to marry someone or have a baby with someone that's also a carrier, like both of my parents was, and didn't know, then you'll get me. Or her, or whoever else has the illness. So that's one. That's the trait. Second is SC, which is S beta. No, it's just SC. So that's what she has. And I have S beta thal, which is sickle thalassemia, and then there's SS, which is the most severe of sickle cell. Fortunately, I don't have SS, and she doesn't either. But yes, but I will tell you, I have gone through the same exact things that they say only SS patients will go through. They're the only ones that's ever going to need their spleen, not spleen removed, their spleen shrinks. They're the only you're never going to have to deal with hip replacements. You're never going to have to deal with, needing a port. I've had 3 ports. I'm on my 3rd. Which one are you on?
Shoot, number 6.
Yeah, she's on number 6. And what a port is, basically what it does is it allows, you don't have any veins. You being stuck your whole life, and you don't have any veins. So what they do is it's like it's a device they put under the skin, which is connected to like an artery, major artery.
Straight to the artery.
And so like mine is here. Mine is in my arm. My other ones were here. If y'all could see the scars there. Most people do have them on their chest, but I'm too vain for that. I like to show my cleavage.
Lord have mercy,
So you ain't put no damn port up there. I'm a vain bitch, and I admit it. So
whatever.
She got hers on her chest. She's better than me.
I'm still beautiful. So
yes, you're right.
That's right.
That's right.
And see, Lady D shows hers.
She sure does. I show mine too. Because you don't know it's there.
Right.
But yours is more hidden.
Yeah, mine's hidden. Yeah.
You don't have to get. Oh, what's that?
Right. Yeah, because that's exactly why I didn't want it in my chest.
Is that a keloid?
Right.
Yeah. That's right.
How about if they feel it by accident? Because I've been to the nail shop and they've done like, manicure, and they massage your arm and they go up and it's like, oh, what is that? Oh my God. And I'll be like,
Wow.
then I got to explain.
What it is.
And they don't understand. They're just like, what the hell is that?
Mhm.
Another thing I wanted to say, I know you didn't ask this, but growing up with sickle thalassemia, it was something that I was definitely ashamed of. I was, because you're in class, and let's say you're in health class, and they talk about sickle cell in health, and if you say, "Oh, I got that, I have that, I have a form of that," chairs moving away from you.
Wow.
You got the
What?
cooties.
How you get it? Is it contagious? Oh yes.
Oh my God.
So I just learned, just don't share it.
Mhm.
You know what I mean? Just don't share it. But fortunately, I grew up pretty good. I didn't have that many crisis or issues growing up, but until I turned about 17, 18, it really started kicking in. But I knew from birth.
Okay.
She didn't. So I know you
Yeah,
had a
one of my
question.
questions-
Wait,
Yeah.
time out. But can I ask you a question though?
Yeah.
So as a kid, since you was ashamed, are you
Mhm.
ashamed as an adult to talk about?
No. Oh no. Mm-mm. Mm-mm. I'll let that go. I don't know. I think meeting you and the other ladies, TKO and Sonia and Tanya, they're no longer with us. But in Ebony, it kind of, and me having a sister that has it as well, it kind of created like a safe haven. You know what I'm saying? And we all had this thing in common, and we met, Lady D and I, we met at the Sickle Cell clinic.
Okay.
And that's how we met. And that's how I met all the ladies I just said. But meeting them, it kind of just went away. It was something more not to be ashamed of, but to wear like a badge. You know what I mean? And what I feel is this: you can have sickle cell or sickle thalassemia or SS, beta thal, whatever you want to call it, but it don't have to have you.
You don't.
You know what I mean?
Yes,
It don't have to have
yes.
you, and a lot of us, we don't make it to 21. We don't make it 18. So to be sitting here, both of us at 40,
That's a blessing.
that
Yeah.
man,
That's a blessing.
if we told you our story, you're like, I've coded and died 3 times. How many of you? 1 or twice? Twice. Yeah. This what bothers me about this disease. It's a killer, and we don't get the respect. You know what I mean? As soon as you go into the emergency rooms or you go, you're a drug seeker. Now they treat you good when you a kid, from 0 to 17.
Okay.
They treat you good. They may have feelings about you, may think,
but they're not
want
gonna
to
say
judge,
it.
but they don't say, because you're a minor. As soon as you turn 18, you have now become a drug seeker.
So is that because you don't have this outward appearance of your disease? Or is it could it be that? They just think it's like all in your mind, no, you're not in pain. No, you're not,
I wouldn't say it's that we get a bad rap.
Okay.
And, you do have people that genuinely be in pain. And a lot of people, as kids, we learn when you become an adult, crying doesn't work.
Yep.
Crying,
Wow.
Lord, crying pretty much increases your pain.
It does.
Okay.
So, they tell you don't cry a lot, but kids, they don't understand that. So, of course, they're going to continue to give it to you. But as an adult, they feel that you should have the common sense to know what works for you, what doesn't work for you, what's going to sit here and trigger you. So it's just a rap that we get.
It's a bad rap.
I remember I have a friend, and all through high school, she would have crises, and I would feel so bad. She used to be so small, and she's still a good friend of mine, and she used to always be in crisis. And they told her that if she had got pregnant, and they told her that if she had the baby, she could die, and she just refused to not have this baby because she said that God wouldn't let her get pregnant if she wasn't supposed to. Her baby is like 7 years old, so she was like proud. And it just seems like everybody that I have met with sickle cell are strong,
Really,
really strong.
They do tell us
they're really strong. I only know women, and they're really strong women, and it just seems like y'all go through so much, and it isn't really talked about. I just now last week seen a video about Jordan Sparks promoting her sister's foundation.
Yep, I just saw that,
and that was the first time I ever seen that. But like Lady D told me, she didn't start doing that until her sister passed.
Right.
So that's what I mean. Like
Right.
I can see where you're saying that you don't get the respect because you only hear about sickle cell, you hear T-Boz.
Right.
And
That's right.
And she has. I'm sorry, but
That's
she
right.
half-ass talks about it. She has talks about it. So I don't even.
But
claim
that's what.
grandpa.
But I mean, in the beginning when I was younger and
That's
things,
all you heard.
besides my friend who was actually
That's
in
all
high
you
school,
know.
all you knew was
Celebrity-wise.
T-Boz.
Right.
You didn't know anything else, which is probably why you got the perception that it's just a black disease.
That's right.
You don't
Right. 'Cause
know
we've
much
seen
more
in
about
the
it.
sickle cell clinic, Italians,
You got the Mexicans.
Mexicans,
Wow.
Spanish,
You got the white.
all of that. White, yeah. But back to what you were saying about is it because of how we look on the outside?
Right. That they
Because
don't take
I
you
have
seriously.
gone
That
into
you're
the
in-
hospital
Dolled
like
up.
this, and they're like, "Who's the patient?"
Mhm.
And I'm like,
Wow.
"I'm the patient."
Mhm.
And they look at you like,
How?
You ain't in
Ain't nothing
hooping
wrong
and
with you.
hollering.
Mhm.
You just want some medicine, and then the blood work comes back. Oh my God, you have or the X-ray. You have 3 blood clots in your left lung.
Wow.
Oh, you have pneumonia. We got to admit you. So it goes from ain't nothing wrong with her. She just wants some damn medicine. Medicine that I could take at home in abundance if I wanted to. You know what I'm saying?
Right.
You come to the ER because it's not working.
Mhm.
You know what I'm saying? So if I'm coming to you because my pills at home is not working, then you supposed to give me my IV fluids, my IV meds. But no, you have some doctors that's like, well, I'm gonna give you 2 Vicodins just to be an asshole. Now you know that's what I take at home, or oxycodone, or whatever, or Percocet. And I'm coming to you to take the same thing I could have took at home. No,
Wow.
like it's really bad. It is really bad. It's a very it's sad. It's unfortunate because this disease is more devastating than cancer.
Oh my goodness!
I do not care what no one says. It is more devastating because think of it like this: with cancer, you have a choice, hopefully, if they catch it in time, where you can do chemo, you can do treatments, and you could be cured and be, and live, the rest of your life cancer free.
That's right.
We're born with this, and we're gonna die with this.
So it don't go away. It don't just
no.
fade
It's
away.
like a bad
There's no cure.
relationship. It's a bad relationship.
Wow.
It's like having a home girl that's ratchet as hell.
Okay. All the time.
With you all the time.
Ugh.
People are like, why you hang with this bitch?
Yeah.
You know what I'm saying? Oh, she's so nasty. You know what I'm saying? That's sickle cell.
And
That's
you
what I
can't
call
cut
her.
her. You can't cut her. You can't shoot her.
You can't. You're right.
Wow.
Selena want to show up and she show her ass, and people be like, like, what's wrong with her? It's a bad relationship.
What was your worst crisis?
My worst crisis. Oh, my worst crisis, I would say, was probably a year ago. About a year ago, around my birthday. I had hip replacement surgery, my second one. It went well, went home, everything was fine. Was home 2 weeks later, doing physical therapy. Everything was fine. I don't know what happened, but I woke up because I was still in sleeping in like a recliner chair, which they want you to sleep in for 6 weeks. And I woke up in that chair from a crisis from head to toe.
Wow.
Screaming in pain. The fire department had to come. They had to strap me to a chair because I wouldn't let them bend, make me stretch out. No. It gets to the point where you will crawl up and draw up in a fetus position.
Almost like that sickle.
Like the actual shape of the cell. And I'm telling you, I wouldn't let them move me. They couldn't put me on a stretcher. They had to get creative and strap me to a chair to take me down because I would not let them. It was bad. Come to find out, I ended up having a blood infection. And probably came from having the surgery and being in the hospital. And that was scary. Because not only did I have to do treatment in the hospital, when I got home, I had to do additional treatment 10 days after. And either I had to go to the emergency room to get the treatment, or I have to go to the con center, or it was just a lot. And it took a toll. The medication that they gave me, I forgot the name of it, but it takes a real toll on you. It was really bad. So, I mean, that's probably not the worst one I've had, but that's what's in my mind right now, you know?
So, what are your personal coping mechanisms for your crisis or when you just don't feel well? Because everybody's crises are different.
Yeah, everybody's different. I'm gonna let D answer that first. I'm gonna answer that.
I like the color. I'm a big kid, so that's where I get a lot of my comfort from. Also, I listen to music. Most of the time, they tell you take a hot shower. To me, it really doesn't work. It helps for the moment, but as soon as you get out that water, you're right back in pain. So pretty much, yeah, I just try to distract myself.
Yeah, exactly. Probably just curl up, watch TV, movies or something. I don't have anything like, okay, I'm hurting, because it just comes.
Right,
it's
you
like
never know.
Nothing triggers
You never know.
You never know what can trigger.
And I think I've seen you not feel well, and she'll just go to sleep.
Yep.
Right.
She'll stay, like, if I'm doing with Lyric, we'll be like at the table at the time, and she would just curl up on the couch and go to sleep. And
that's
just sleep it out.
Sleep. That's exactly what you
I can
do.
always tell.
Sleep
I can
that
always tell
thing
because she's always
quiet.
lit. She's always lit. But if she don't feel well, she's like, "Hey, Jazz, da. Money over here.
Right.
I'll see you tomorrow." Because she's going to sleep.
Yeah.
I can tell. I always know.
Yep. So yeah, like I said, curl up, watch a movie, TV, go to sleep, sleep it off. Hopefully when you wake up, it's gone. But it ain't. It ain't. It's
How does
not.
your family deal with your, I guess, crisis or your ongoing crisis?
I mean, I don't know, because you have to ask like my parents for me how I see how they respond. I felt like growing up they didn't really listen. You know what I'm saying? I could literally be like crawling around the house because I can't walk, and I'm like, something's wrong. You know, and so it was always they had to take something drastic for them to take action. You know what I'm saying? But I remember when me and my sister was young and we tried to do the bone marrow transplant, and it didn't work. And so they had me and my sister. I'm like 5, she's 7, and they had us in the room together. And I remember clearly my parents was just like in the chair in the room, and my dad was consoling my mom was just crying. That just sticks out in my head. So I asked my mom, like, years later, what was that about? She said they told us that child wasn't going to make it through the night.
Wow.
And they just stayed in that chair. Wasn't even big enough for both of them, but they wasn't leaving. But so growing up, like I said, I didn't get sick that much until I became older, a teenager, or then later married. I got married at 19, so they didn't have to like see a lot of it, like living in the home with me. But I do remember it's been times I have crawled in my brother's bed and be like begging, D, you probably could relate, for God to make it stop. And if that means I'm gonna die right now, I'm good with it. I'm good with it because you just like, God, just make it stop. It's so bad. It is so bad. You just you're asking for it.
So now, D, can you have sickle cell and not know it?
A lot of people say no, but that's not true. I actually didn't find out. They told me I always had the trait, but I got pregnant at 16. Went to the doctor, wasn't feeling good. I was balled up under the doctor's desk. When he came back, he was like, "Now I see why. You have the full-blown disease."
Wow. Okay.
So yeah, you can.
So you didn't find out till
I didn't
16.
find out till I was 16 years old.
And see, that's hard to believe because you're like, when these crises come, you like that thing kicks your ass. So
But that's
like,
what I'm saying.
Could you not know? But you could, because me growing up, I didn't have that many crises. I probably could count on one hand from birth to 17. So I think it's possible. Even, like my son, he didn't get diagnosed till 9 because he has the trait. Oh no, he just has the thalassemia trait. Oh no, and then at 9, took him to the emergency room, and the doctor said, I'm just running all the tests. Came back, he has exactly what I have, thalassemia, which is crazy because my husband has nothing. So that's another thing they tell you. Oh, if you have a baby, if you have a disease and you have a baby with someone that doesn't have anything, the worst case scenario your child will have is just a trait.
Okay.
Not true.
Wow.
Our child has the full-blown disease. And then our youngest child, our daughter, she has thalassemia. So they each got something from me, and their dad has nothing. So I don't know how doctors gonna answer that one.
Well, I have all the juicy questions. So if you have a really bad crisis and you do have access to medicine, how easy is it to get addicted to your medicine, and how do you conquer that?
Okay, I could tell you a story, personal story. So let me tell you how these doctors tell you to take your medication. Okay, because they really the drug dealers. They'll tell you something that's called long active. That would be something like a morphine pill. That would be something like an Oxycontin pill or a Dilaudid pill. And they want you to take it once in the morning and then once at night, 12 hours apart. One or two pills or something like that, 12 hours apart. They say to do that to stay ahead. So, if your body's trying to have a crisis, you'll have that dose of medicine in your system already, right? Okay. So you're taking your medicine as prescribed, and they don't tell you you stop. Oh, you're going to go through withdrawals. So, I had my spleen taken out. I'm like 21, got my spleen taken out, my gallbladder removed due to sickle cell. And, I go home and I take the pain medicine the way they told me to take the pain medicine. And so when I was better and I was like, oh, I'm good. I don't need no more. Throwing up, diarrhea, shakes. I didn't even know what I was going through. I thought I was just sick.
Yeah.
So we rushed me back down there and the doctor's like, oh my God, okay, got my meds, and it all
Stop.
I was like, that shit was withdrawals.
Wow.
So I went years having to take the medication that way, not to get high, but to function, just to function. So basically I was an addict to that medication. Maybe not an addict in the sense of I gotta have it or whatever, but you do have to have it.
You have to.
Or you can't.
Or your body.
Function.
Yeah.
You will literally get really sick. So what I did was I just weaned myself off of it.
Good for you.
Slowly. I just weaned myself off. I was on Oxycontin at that time. And how I weaned myself off of it was one day I said, okay, I'm not gonna take two. Every 12 hours. I'm just going to take one for the whole day. Once my body got used to that, because you'll have light withdrawals, but you can tolerate it. And then you just say, okay, this one pill that I'm taking today, and I'm going to make that half. You know what I mean? Do that for 2 days. And so that's how I got off of it. So, yeah, they don't take nothing but 7 days, they say, to be on medication.
To be addicted?
7 days. If you take that 7 days straight,
you're hooked.
You can be hooked. So that's why you have to alternate, so you don't be caught up in that. I'm telling y'all, fellow warriors out there, get off that stuff. I'm telling you, seriously, because since I've gotten off of it, I mean, not saying that I don't take it when I need it, because I do. I just don't take it that way. I can't take it twice. You know what I'm saying?
You won't be able to
day.
function. You can't function.
Yeah.
Because doesn't that put you to sleep?
It can, right.
Right. Like, that's very
So it's like
heavy
either
stuff.
I'm going to be sick with withdrawals
Or sleep.
or be sleep. But your body does get used to it. So you don't get sleepy and get all those same effects as you first did when you got it, because now you're immune. You know what I mean? But it don't take long. It don't take long. Yeah.
So, sickle cell with pregnancy. How was that for you guys? Because let me tell you, I don't have nothing, and it was the worst experience of my life. I hated being pregnant.
Right.
Exactly.
Yeah.
So,
Well, okay, pregnancy, because I had my son at 19, I had him young, it was easy. I had no problems, none. Then I had him, and shit changed. That's when I started really having crisis.
Wow.
Yeah, like my body just changed. And then, so fast forwarding years later, having my daughter, God, that pregnancy was rough. My pregnancy with my son was easy, but the delivery was hard. My pregnancy with my daughter was rough, but the labor
was easy.
Labor was easy. But with sickle cell, they tell us, like your
Don't
friends,
have
don't have kids. They told me
kill you.
They told me I couldn't even have kids.
Yeah, they said the same thing.
Yeah, I was like 12.
Yeah, they were surprised.
They just tell you that.
That's why they were surprised.
They tell you that.
And they be like, don't do the full. It's either you or the baby.
Or the baby. Yeah.
Wow.
Yeah.
She said, I'd be damned.
Yep.
I'm having this baby.
Yeah. Yeah. So they take, I'm like 12 years old. I never had a pap smear, never had anything. How you gonna tell me I can't have kids? You did an ultrasound?
Wow.
You did you checked my apartment down there? My apartment is good. You know what I'm saying? You gonna tell me you can't have kids. They do, they will tell you that.
So lady, how was your pregnancy?
Yeah, because you laughed.
Yeah.
I was sick. I didn't have the morning sickness. I was sickle cell sick.
Oh, whole pregnancy. Both?
Because she said
First
that's how she
one,
found out.
That's how I found out.
Right, yeah, that's how she found
The
out.
first time, yes. Second time, it was a lot of pain. But once I got over it and we figured out what was causing the pain, I was fine. But with my second daughter, I had pneumonia. So, yeah, I was all screwed up.
And you can't take no medicine pregnant.
Yeah.
Yeah, you can.
Yes, you can.
Yes, you can.
Yes, you can.
They doped me the hell up.
Let me tell you, okay?
I was doped the hell
my
up.
daughter.
Okay.
I said she a little
Yes.
she was getting a little bit.
They do. They do.
You know, she was getting that morphine.
Wow.
Girl, the doctor told me, because I was like, I don't want it. They were like,
it's not gonna hurt.
Your body's gonna go into shock and you'll die.
Okay.
So you're gonna take this pain medication.
Okay.
So I was like, okay.
They don't give you a large amount.
Yeah.
Just a little bit.
Yeah.
But I could
they got the
tell
good
when
stuff.
I got it, she got it.
It was the good stuff.
Because I was like, oh, wait, she slowed down. I said, oh, my baby
She's
high.
feeling no pain right
My
now.
baby is high. So, yeah, they will give you pills, take your pain meds every 12 hours, all that through your pregnancy.
I didn't know that.
Yeah.
They didn't let me take no medicine when I had the flu.
Not even antibiotic?
They told me to take like
the counter.
What? I'm still dying here. You know, when you're pregnant, everything is a die. Everything is super extreme. Yeah, you're not hungry. Your soul is hungry.
Starving.
I'm a die. This baby is trying to get out. That's how hungry I am. So then if you're sick, it's just like,
yeah,
that's true.
Save me.
But I was pretty good, like crisis-wise, set with my daughter. I was in labor, I went in labor 4 times with her. I went to a crisis, and then the crisis, you know,
triggered your labor.
Yeah.
Oh,
exactly.
man.
So that stopped labor 4 times.
Oh,
so,
man.
But yeah, they give you medicine.
Yeah.
But now I'm trying to. All right, you both are adults dealing with this. So how did you watch your babies deal with this? You know, because
with my like I said, I didn't find out till he was 9.
Okay,
and so. Luckily for him, he has a mother that knows about the disease, knows what you can't do, what you shouldn't do. And he was in sports. Been in sports from 3 years old, both of them. Basketball, baseball, football, he did it all. So we didn't take him out of anything. We just let the coaches know he can't practice out here when it's cold. He can't practice out here when it's raining. You know what I mean? Another thing, like with the swimming pool, that's another trigger that can cause crisis. Like if you go to the pool and you stay in the water too long, the chlorine, instant crisis. Wow. You get out that water. I don't know what it is about the chlorine.
Yeah.
Yes. Yeah. So when you go swimming, I had to teach him over. You can't just be in here. You know what I'm saying?
Just chilling.
You got to get out every 10 minutes, stay out for 20, and then you could go back in. Yeah. So
Jesus.
Yeah.
Everything is like a formula. To not get a crisis. Because the thing is, I'm telling you, my friend she is still smaller than you. You know, we call her Slim. And I just remember her just going through it would be times she wouldn't be in school for weeks and we would be like, she in the hospital. Or we would just be calling her. We would be trying to go see her. Like,
it's
that's
no
crazy.
Joke. It's really no joke.
You crazy.
So me? Oh,
I know you tried to escape from the hospital.
Oh,
do tell.
Girl, I've escaped several times.
She posted it too. She said, I got out. I got out.
I escaped
She said, I'm
several
breaking out. I'm
and my
breaking out.
kids.
She's always escaping from the hospital.
They were the culprit.
She's always escaping.
Girl, I'll leave in a minute. And because we have ports, like if you leave the hospital and you have your port still access, oh, honey, they sending them cops after you.
The cab county gonna be at your front door.
At your door. Yes, they will. So I always let them know when I leave. I left that port. It's on the bed. Don't send them after me. It's on the bed. They be like, she took up. Yes, I did. I'm a doctor. I'm a nurse. I'm a tech. I'm a radiologist. I'm whatever the hell I say. I'm a pharmacist. I'm whatever I say I am. When I'm well versed in this shit called Selena Sickle Cell. That bitch show up. She's so dead. Shut up. Shut up, D. She's horrible. You know she is. That's why you laughing. She's horrible. But you know, you gotta love. I don't know when I started just accepting it and just was like, okay, it's part of me. You know, I'll just accept that ratchet ass friend. You know, we just ratchet together.
Right, she ain't going nowhere.
She ain't going nowhere. She ain't going nowhere till I go somewhere.
She really like your cousin.
I just don't want her to be the reason I go somewhere.
Right. That's right.
That's you know what I mean. You know, we've lost 3 friends back in 3 week time. Back to back to back, one every week. And that's so scary because you're like,
yes,
that shit is swinging. You know what I'm saying?
Hit or
that
miss.
pendulum.
It's like hit or miss.
Oh,
one day you up, one day you down.
Right. It's scary. But before we go, I do want to discuss how the type of treatment we get. I know I touched on it earlier and I said that they see us all as drug seekers and everything. But when we tell y'all, if you was to go into the hospital and had whatever kind of pain, say you broke your ankle or whatever, they'll give you the good stuff. They'll give you no problems. They'll discharge you. You're good, right? When we go in, it's like from the jump, from the time they start doing your vitals, it's like, how long you been hurting? Okay. You know what I'm saying? So that's
attitude.
That's just you ain't even in the room. You ain't even back in the room yet. Then you get in the room and then the doctor comes in, well, the nurse comes in first, you know, and it's like, okay, so
what size needle?
What size needle? Okay, I'll be back. Then the doctor come in. It's just like you keep
discrimination.
It
really.
is so bad. It is so bad that a lot of these doctors and nurses had to be retrained on how to deal with sickle cell because a couple years ago, a couple of sickle cell warriors and their parents and advocates went to Washington and like we're tired of this treatment. Like we're tired. So they had to redo how they trained at Duke College. The training they get there was good. So they came and was teaching. They even came to Atlanta and was teaching our hospitals here. You know, like it's
but they
really
still treat us like shit, so it don't even matter.
I don't even go to the emergency room. I don't even know.
They personally just suck.
But
in general.
It don't stop there. It's my point. Once you leave the hospital, it ain't over. Because now I gotta go to WldCrd. I can't stand them. So now I gotta go to WldCrd. Okay, now I gotta drop off my
prescription
C2 drug, and okay, they hand you your script, right? Looking up at you, looking at what you get, looking up at you. They want to ask you, what's wrong with you? You know what I'm saying? Like, are they giving you all this hot stuff? What's wrong with? But they can't.
Wow.
You know what I'm saying? So, but they just looking, and then or they'll lie. Oh, we don't have any. Well, the last pharmacy told me to come here because they called y'all and they said that y'all had enough here. That's why I'm here. Oh, you're the one that they called for. Oh, okay. Oh, so now you have it. Now you have it. You know what I mean? It don't stop there. It don't stop with the doctors. It don't stop with the nurse. It don't stop with the techs or the people that take you back out. Or registration or whatever. It don't stop there. You leave the hospital. Where you gotta go? You gotta go to the pharmacy. Right. So you go there, you turn your script in.
Prescription.
Right, with your prescription that a doctor wrote.
Signed by a doctor.
Right. So they write it, fill it. You know what I'm saying? But a lot of these pharmacists, they do have discretion, and that's cool. You know what I'm saying? But they take their feelings and they start using their feelings as policy, and it's not cool, because I don't have to come in here bent over to tell you I just had this done or I'm going through this for you to fill it. Drop it or fill it. That's it.
That's against HIPAA too. That's a HIPAA law. I shouldn't have to tell.
Right, you shouldn't. Right, that's why I said sometimes you could tell they want to ask you like, "What's wrong? What's wrong with you? How you getting this?" But they can't. They can't. So, but I think in the system now that I think now the hospitals or the like if you're a patient, like someone
they have it
that gets medication regularly, it'll be in the system, and I think in your diagnosis. I'm not sure, but anyway, so I had a pharmacist that I gave her the prescription. She lied. She was like, it's too soon, you can't get it, or something, you got to come in a couple days, or something, or we don't have it. She lied. Whatever she did, she lied. So she was like, so in a couple days, you come back and pick it up, when we get more or whatever. So I was like, nah, just give it back to me. I'll go somewhere else. I'm not waiting a couple days. It's not too early to get filled, but no. So what she did was I left. I see her the next day. I did an event for a Nigerian family, like a big Nigerian wedding. I did the whole event, and she came in there and she saw me, and I said, "Oh, you never know who you're gonna run. You never know who prescriptions you're filling. You never know what I do." I said, "What you did was you looked at me." You saw what I was getting, and you judged
you.
And and look, I'm the one that did your whole friend's wedding. Because she's like, oh my God, it's so beautiful. How did she know? Is the decorator, is she African? They're like, no, she's Cuban. Oh, let me meet her. And then she and I said,
small world.
And she looked at me, and I looked at her, and we had a talk. I did. I told her, I was like, what you did? What you talked? Yeah, what you did. You judged me. Right. And I hope that taught her a lesson. I really do. But you used to have to, when you lived in Virginia, didn't you have to drive to another hospital out of town so they could treat?
It was Arizona.
Okay.
So what it is, they have a hospital that tends to sickle cell, but the population there, it's up and down. Okay. Arizona, you do have a lot of drug seekers. So they tend to call everybody a drug seeker. Oh. So it'll get to the point where you be sick as hell and you go to the ER and they be like, oh, we're not going to see you. And they will
turn people away.
They will physically turn you around. They will look at your chart and be like, oh, we're not going to see you today.
Oh my goodness.
So it got to the point where I was like, you know what? I'm right here. I'm like 5 hours away from Cali. What's 5 more hours for being in pain?
Oh, she went to drive.
I will drive to the borderline of Arizona and California to go to the doctor. Just to
get treatment.
Because they have it in the system where in Arizona, and I get it now why they have it. Say, I'm going to use the hospitals here, for example.
Okay.
Say you go to Grady. Grady doesn't give you what you want, but they give you something. You turn around, you go to Atlanta Medical.
Okay.
Grady already has it in the system. We saw the patient. This is what we gave the patient.
Okay.
You go to Atlanta Medical, they can see it pop up. And in Arizona, that's a big problem they would have. They would have people that would hospital hop.
Hospital hopping.
Okay.
So that hospital hop affected everybody.
So they put everybody in the same box.
So everybody was put in the same box, no matter how sick you were. If you wasn't in there damn near dying.
I've had to, at the Sickle Cell Clinic in Grady, I kept telling the doctor, I don't feel good. You keep saying I could go home. So no, you could go. You need to go home. I said, okay. So how they used to do it was you would show up there, you would have 6 to 9 hours of treatment of fluids, and you get your pain meds and everything every 3 hours, right? So after your last shot, you might want to go home about it. They'll come discharge you like an hour after your last dose of meds. And they would basically, you got to go. We're not admitting you. There's nothing wrong. You keep saying, yes, it is. So I said, oh, okay, I got something for them. I let them discharge me, and I came right back in. I did it 3 times.
You have to. Sometimes to prove a point,
and
you have to.
I had pneumonia.
Oh my gosh.
And I had pneumonia. Yes. So I kept saying, no, okay, your protocol, you want to discharge me? Okay. So they discharged me. As soon as they do the discharge, I start filling the other form out because I'm signing right back in. 3 times that same day I had to do that just for them to admit me. Yeah. You know, they're quick to tell you nothing's wrong. They send you home, you die. You know, you have a blood clot or, you know, pneumonia. You know, it's crazy. Yeah. They sent a girl I know just passed. She had a baby. They sent her home. Had a C-section too. Sent her home after 2 days with sickle cell. Sent her home. She died. She died. Yep. She died. My goodness. Yeah, that wasn't that long ago. So the care that we get and the treatment that we get,
it's horrible.
Is bad. It's bad. A lot of these doctors sometimes, you know, they feel like they have God complex. You know what I mean? Then you have some that, you know, they see another doctor doing wrong, and you could tell they feel bad, but they don't. They go along with it. They go along with it. They go along with it. You know, then let's say you may see that doctor. Now, we have a doctor. You know what I'm saying? Most sickle cell patients, we have a hematologist. So when we're talking about going to the ER, that's only because our doctor is
she's not a hospitalist.
They're not hospitalists. So when you go to the ER, you're bound to see, you're liable to see different doctors. You're not going to see your doctor. You know what I mean? So this is not somebody that knows you, knows your history. So you're automatically drug seeker. You know what I mean? Unless it's a person like me that barely goes maybe once a year, if that. Then they'll pay attention to me. You know, versus if I was to come a lot, because there's been times that I used to have to go a lot. Every 3 days, because something was going on and they wasn't catching on to it. Like they took 2 years to diagnose me with hyperthyroid, right? So I kept getting sick, you know what I mean? And I'm not gonna front that, I'm gonna be honest, going down those days when I was running down there to Grady like every 3 days, I was going down there. 1, I didn't feel well, honestly. 2, it was like a escape. It was like a getaway, you know, and I would go and my friends are there. Well, we like, oh, you bringing Chinese food this time? What you gonna bring? 3 more days, I'm gonna see you. What you want some pizza? It like became like a hangout.
Clubhouse.
It really did.
It was like, okay, this is a schedule.
And in the beginning, they were cool with it. But then they started seeing this as a pattern, and they're coming too much, and they're coming together. They ain't sick. And a lot of times we wasn't. It was literally like a hangout. And then I'm getting these drugs. Baby, what that thing used to do. Woo! I'm telling you.
Yeah, you were telling me about this one drug that I want to look. Can I go in there and say and get it?
That thing be on fire. She be throbbing.
Wow.
Talking to you. Oh, yeah. So, so you would go for several reasons. I'm just going to be all the way real. You know what I'm saying? So, but I had to get myself out of that, you know what I'm saying? And realize I could still maintain those friendships outside of sickle cell clinic. Right. And then that's what we did. So that's how we became friends and the other ladies you've met. So, so I'm just being real. But the treatment, I mean, I don't know. Has it got better? Like, have you been to the ER lately?
I'm not going to say it has gotten better, but they have turned certain things around, but they still treat you like shit. They still treat you like shit because now they have this thing where you can physically see that they treat you like shit because you could walk in and you be on your phone and honestly don't be talking to nobody and have your music in. Oh, well, I'm not going to treat you because you on your phone. Bitch, I'm listening to music.
You saw them when they come in the room to give you a medicine?
No, when they come in, period.
Oh.
Yes.
So being picky. Like,
you know, you have, of course, nurses have who they want to pick and choose and who they feel like I can step over and I can boss. So you have to deal with that. But for the most part, no, ain't nothing changed other than the doctors that see you. So, they're more nicer.
What do you feel for our fellow warriors out there? Do you feel like natural route is best or the Western medicine?
I hate taking medicine, so
Right.
I'm just gonna say,
natural.
the natural way.
Mm-hmm.
Because it's hard to come off that medicine.
It's hard.
Especially if you have a life.
It's hard.
It's really, it's really, really hard.
It is. It's
How
hard.
am I supposed to function
Mhm.
Monday through Friday? But here it is, every 72 hours, I have to change a pain patch. If I don't change this pain patch, I'm shit out of luck.
Yeah, because you have to. Yeah.
Right. So I'd rather just roll it up, chief it up. Hey, do what the hell you do. I'm so for real.
I mean, I agree. I think, now that weed is about to be legalized here soon anyway.
Welcome.
Right.
True.
You know what I'm saying? Like, I because the THC oil that we're allowed to get and cancer patients, that stuff works.
It works, but it doesn't work
It works.
a lot.
Okay. It worked for me. But I'm not no weed.
So you're right. Your tolerance is,
my tolerance is low to weed or whatever. But I believe in the Western medicine.
To a certain extent.
Yes, to a certain extent, to where you're not addicted to it. If they can find a way that we can take it and not become addicted to it, our bodies become addicted to it, then that'll be real good. But I don't know if they're gonna make a drug like that. I know they have something called tramadol, which is like a synthetic morphine, but it's synthetic, but it doesn't. You don't get addicted to it. Okay. Or I don't think it has opiate in it or something like that. So if they start making more drugs like that, I think that the Western route can work without creating addicts and drug seekers. Because I get tired of getting that feeling when I go into the hospital.
But you're gonna get that feeling regardless because you have a disease.
Yeah, I will. Because you're sensitive to it.
So you're supposed to go in the hospital with your hair all matted, smelly, and
screaming, whooping, and hollering.
No makeup, cursing everybody out, hollering, everything, and that's what they want.
That's how. Yeah, because if you come and calm collected or go in looking like this, ain't nothing wrong with you. So I just want to say to fellow warriors out there, stay hydrated, stay motivated, and we can do anything. We can do anything. I know it's hard. It's hard for a lot of us to finish school or work or get a job, or we go to college and, we get sick at work. So I really, really just stay motivated and busy and believe that you can really, do some good things out here.
That's right.
In the world. Right. Don't let the disease have you. You can have
your
it,
disease,
but don't let it have you.
That's right.
And there are supporters outside of the community that will support you and rally behind you.
Yep.
All the way.
Yeah, it is.
All the way.
So
we all support you.
Wrap it up. Yes, you did.
Did I answer your question?
This was for me because I always ask her questions about sickle cell because I was really curious about it. Yeah. So all you people from our sickle cell page, just stay encouraged.
Yep.
We label y'all as the #warriors.
That's right.
Because you can do anything. You can do anything you want to do.
Yep. I came up with this whole idea, podcast idea based off being sick.
That's right.
Having to have 2 hip replacements. Like, what can I do now? So
that's right. Life is not over.
It's not. And we could be late bloomers.
That's right.
I'm a late bloomer.
Better late than never.
There you go.
Right.
I'm a late bloomer.
That's better.
So anyway, gardeners, we love y'all. Don't forget to like, share, and subscribe.
Yes,
and to the warriors, we love you as well.
Yes.
Stay motivated.